Hey everyone, Dr. Rob Walcher here. Today we are going to discuss a condition that is very common, and that is elbow pain. Most likely you'll go to a doctor and they're going to tell you you have tendonitis. Tendonitis just means that the tendon is inflamed, most likely because of repetitive stress. Maybe you type a lot, maybe you're a golfer, maybe you're a tennis player, and that's why it's called tennis elbow. So repetitive stress creates inflammation, creating elbow pain. So what can you do to fix this? Because this is a very aggravating injury because it takes so long to go away. And the reason for that is because we continue to aggravate it through workouts, through our work, just our daily activities. We're constantly flexing this muscle, aggravating and continuing with the inflammation. So of course, rest. Rest is a great thing to do to help alleviate the tendonitis and the elbow pain. You can also put ice, 15 minutes, several times a day. You want to reduce that inflammation, and ice is the #1 natural way to reduce inflammation. One of the most effective things that I have found is these bands. They're very inexpensive, called tennis elbow bands. And what you do is you place this here like this, right on the brachioradialis muscle, right across there, and then you're going to tighten it very tight. And so you wear this throughout the day, and what it does is it alleviates the stress on the actual tendon and allows the inflammation to go away. So this is very effective. There's also remedies such as ART, or stripping the muscle with some deep tissue massage. There's several things that you can do, and all of them play a role in helping get rid of this painful condition. Another thing that most people don't realize is that chiropractic care can be very effective at helping this condition, because as a chiropractor for 21 years, I have found a correlation with tennis elbow and cervical spine problems, thoracic spine problems, and shoulder. See, it all works together. If your joints are not working properly or moving properly in your neck, your shoulder, of course, that's going to cause a cascade of abnormal stress in joints, leading to inflammation when you have repetitive stress. So we're going to go over a few adjustments that we do to help alleviate this condition. So what I've found is when our neck is out of alignment, this leads to abnormal stress, obviously in our neck, but also our shoulder, leading to our elbow. So the neck commonly becomes misaligned as we go through life, because our neck from the side is supposed to be curved like this. That's called lordosis. But as we age, our neck straightens. Our head goes forward. Some people go very far forward, called anterior weight bearing. But a loss in curve is called hypolordosis. And this lack of mobility leads to stress on the middle back, shoulder, all the way down to the elbow, especially when we have repetitive stress, comes all the way back to the spine. So right now we're going to adjust the neck, working on that lordosis. Good. There we go. Great. Same thing here. Again, working on that nice natural curve, alleviate the stress on the spine so our joints move properly. Okay. So the stress that has accumulated in the neck then leads to stress in the thoracic spine. The thoracic spine is 12 vertebrae in the middle back. So we're going to alleviate the stress in the middle back. Okay, this also is going to restore mobility in the shoulder. Just relax all that air. Good. Okay, we're going to go a little lower. Good. One more here, all the way down. Good. Good. All right. Excellent. Okay. Next up, we're going to check the shoulders. So we're going to just turn this way. You're going to put your hands on your hips like that. Good. So we're just going to have you push your elbow back, and I'm going to push forward when I tell you to. Are you ready? Okay. Push back. Harder, harder, harder. Go, 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 go. Okay, good. That one's good. Now this one, go back all the way. Okay, good. Now we're going to just turn this way towards me, and we're going to check your elbow. So we're checking the radial head. Okay, oftentimes that can become subluxated. So we just see that's already kind of moving a little bit. We just kind of want to just do a little mobility and restore that motion there. We're going to check the wrist. See that already? There's 8 bones here, and they also can become fixated. So we want to release that stress, increasing the mobility. And then here, good. All right, now we're going to turn. Good. Checking the radial head. Relax. Good. Okay, so yeah, you move real easy. It doesn't really require a lot of force. You're just going to gently mobilize those joints. Good. All right, so again, our goal is to alleviate the stress on our joints, increasing the mobility so that when we have repetitive stress, we don't get this type of an inflammation. So we find that chiropractic care done with the remedies I discussed earlier, ice, rest, and the armband are gonna effectively wipe out your tennis elbow. So if you have any questions, please leave them in the comment field below. You can find out information about our clinics in the link below. Have a great day, guys. Always remember, your health is your wealth.